Just about anybody is a good candidate for dental implants. I mean, dental implants has become such a routine procedure in dentistry. When I first started in the 90s, it would be like a rare patient that had implants. For us, we're using dental implants on just about all ages. The only time somebody's not really a candidate for an implant is somebody who's very young. But most dental implants are placed on patients who are middle-aged to older because they're the ones who are missing teeth. Because for us, dental implants are a first choice if somebody's missing a tooth as opposed to some of the older treatments we would offer a few decades ago. It's really if you want it. It is the best treatment. It's about your quality of life and how you feel about it. And we don't know what her decision is going to be yet because it's really highly personal. The process of getting a dental implant has been greatly simplified with a lot of the digital technologies that we've been able to employ in the practice in the last few years. If somebody comes in and has a missing tooth, we can start the placement of the dental implant within a week, maybe 2 weeks. We use digital scanners to scan their teeth and make a digital image. And then we also have what we call cone beam CAT scans. So they're not the CAT scans people would be used to in like a hospital. You don't go in any tube. They just spin around your head and they'll make a 3D digital image of your teeth. And with the intraoral scan, which is an image of your teeth and your gums, and the radiographic image, we can merge those together and produce guides that allow us to precisely place the dental implant. That technology is just amazing. I've been placing implants for more than a couple decades, and it used to be like a finish carpenter. We would measure, we would figure it out, we would do it that day, and we'd have to use our skill and our training to place the implant. Now we do all the planning up front, and the process of placing the dental implant for the patient is much safer, much more effective. Most people think the dental implant is the tooth. Actually, the implant is a titanium root that you put into the patient, and it has to sit in the bone for about 3 months. It can sit longer, but that's the biologic process for the bone to grow and what we call osseointegration. It just kind of fuses to the implant. So I often tell patients that if you put a screw into a piece of wood, and you went back 3 months later, you could easily reverse it out. But with a dental implant and the process of osseointegration, that bone grows so intimately to the implant, which is made out of titanium, that if you tried to reverse it, it won't come out. And now you have a platform to make an artificial tooth that looks exactly like any crown, if anybody would have a crown or a cap, just like that, and it kind of gets just attached to that implant in the bone and functions as a tooth. It's been one of the greatest changes in my practice, and our ability here in our own office to plan and place implants allows patients to get their teeth restored or fixed much quicker. We got trained in dental implants for the convenience of our patients. When you have to refer patients out, it's not convenient for them. Allowing us to control the placement of the implant and the restoration of the implant, where most general dentists are just doing the restoration and the final part of the implant, we think is better for our patients and allows it to happen more efficiently.